Did you know that April is National Foot Health Awareness Month? It's important to take care of our feet as we accumulate 4 to 5,000 steps every day. As a podiatrist, I chose this profession because I believe in the power of movement and the importance of foot health. I wanted to specialize in sports medicine, and podiatry was a great opportunity to address the foot, ankle, and lower extremity injuries. It's very hands-on. As a podiatry physician, I can perform both clinical procedures and surgeries. The field of podiatric medicine also allows you to have a great diversity ranging from treating sports injury to treating skin and nail problems, to perform surgeries, to perform radiology, and also have a great work-life balance. Sports has been a huge part of my life. Growing up, I played a variety of high school sports: basketball, cross country, track, and bowling, as well as participated in many recreational activities. I gained an understanding of the importance of the foot and lower extremity in sports. I always wanted to combine my love for sports and my interests in a diversity in podiatric medicine was a great fit for me. Our feet are the foundation of our body, and taking care of them is important for overall well-being. Invest in good shoes. Supportive footwear with proper arch and heel support can prevent issues like plantar fasciitis, Achilles tendonitis, flat feet, bunion, hammer toes, and even ingrown toenails. Keep your feet dry and clean to prevent infection. Proper nail cutting is critical to avoid painful ingrown toenails. Avoid going barefoot in public spaces, and wearing uncomfortable shoes that can lead to foot problems. Every step you take matters. Remember, taking care of your feet is essential to your overall health and mobility. Happy National Foot Health Awareness Month.